A very good evening to all of you. It feels really great interacting with you after such a long time. I know this is one-sided interaction, but it still makes me happy taking classes. Okay, so today I am here to discuss topics of social justice. See, as far as social justice, the areas which was supposed to cover was basically poverty, hunger, health, and education. Apart from that, if there is something left, that would be taken care of by other faculties, either of polity or governance. But these four topics I would be covering. So poverty and hunger, already the lecture has been uploaded for you guys. As far as health and education is concerned, I am supposed to cover that. Now, as far as health is concerned, see, I have already provided you the content. The reason for providing you the content beforehand was basically so that I'm not supposed to dictate. Dictation in an online lecture seems very boring. So I know now the content you already have. Now in this lecture, what I'm going to, okay, by the way, one disclaimer, I have prepared the content and I have a certain perspective in mind before preparing this content. My job in this session is to convey that thought process or a perspective as in why I have prepared the content in a certain fashion, how you are supposed to use this content and where all you can use this content. So this is the idea behind today's session. So today I would be covering health and tomorrow I would be covering education. Okay? So let's begin. And before that, I am hoping that you guys are taking care of yourself and you are just studying well. Now, I know many people have already told you, I'll just repeat myself in another 30 seconds or so, that this is the best opportunity. Prelims have got postponed. You still have time if you've not prepared. And if you were prepared for prelims, but you're not prepared for mains, 1.5 months still you have in hand where you can focus on all main specific topics as well as optional. Because this time the time lag between pre and mains is less. So if you are not prepared with your mains, see, at the end of it, you just don't have to clear prelims. You have to secure a rank, and for which it is important to clear all the 3 stages. Okay? So have a very integrated approach, and just don't think that abhi main prelims ko hi baar nahi. Prelims and mains ko, you have to take it in a very integrated manner and just prepare well. If you have any doubt with respect to preparation, you know where you need to contact me. Okay? I'm always there for you guys. In case, I'm so sorry, in case I have not replied to any one of your mails, please just resend the mails. I'll tell you the reason. Many a times, there are many mails I'm receiving every day. So many a times I just forgot to reply. I read the mail and I think that, okay, I'll reply in some time, and then I just forget. So in case, then I really apologize. I'm trying my level best to reply to all the mails, but sometimes it gets taxing. So just drop me a mail or a reminder again. I will get back to you for sure. Okay? Chalo, let's start now. See, as far as health is concerned, why did I make? If you've been my student, you know my teaching pedagogy, that there has to be a certain flow chart. Okay? So what we are going to do here is that first and foremost, you need to establish what exactly do you mean by health. If you look at the first para, so what exactly? So Mahatma Gandhi has already said, it is the health that is the real wealth and not the pieces of gold and silver. Bologe ye kya zarurat thi? What if you get an essay? Health, poverty, hunger, education, very probable and favorite topics of UPSC. So you should always be prepared or handy with quotes. So this can be one of the quotes. There is a very famous French proverb which says, if wealth is lost, then nothing is lost. If health is lost, then something is lost. Okay, that can be used. Then in your Upanishads also, in your Upanishad it is written, Sarve bhavantu sukhina, Sarve santu niramahe, which means may all be happy, may all be healthy. So in that situation also it can come very handy. I am just giving you innumerable sense. You can write whatever you feel like. I never impose that this quotation has to be written. All I'm trying to say is that just have 1 or 2 odd quotation at your disposal, that in case you get an essay, then you can start or end or wherever you feel like you can use the quotation. Is that very clear? I'll just repeat once again. Sarve bhavantu sukhina, sarve santu niramaya. May all be happy, may all be healthy. This is what is written in the Upanishads. Then French proverb, I have already told you. Then what Mahatma Gandhi is saying or has said is already there on the content. It is health that is the real wealth and not the pieces of gold and silver. That's just the beginning. Then I thought that you should be at least aware of the fact that what exactly do you mean by health, good health. A general perception that we have is that if you are not ill, that means you're healthy. Matlab, absence of diseases or illness is synonymous to being healthy. But that's not the correct or a comprehensive interpretation of good health. So according to World Health Organization, it says or it defines health as a state of complete physical, mental and social well-being. Just a second. Physical, mental, social well-being, and not merely absence of diseases or infirmity. This is what WHO has talked about when it defined health. Even in ancient India also it has said that health looks into the various aspects. For example, health is defined as physical, mental, spiritual, emotional well-being of an individual. So it's a very comprehensive thing. You cannot say just that you're not ill does not mean that you are healthy. Am I clear with this? So you have to remember this. Otherwise मैं इतनी बात नहीं बोलती अगर ये जरूरी नहीं होता याद रखना. So according to WHO, पूरा मटेरियल आपके पास है. एक हाइलाइटर लेके sit with a highlighter or a marker, whatever you using, and just underline, highlight the portions which I'm going to talk about today. Or if I give you any extra information, just make noting of it. तो एक loose sheet लेकर just sit with a loose sheet, pen and a highlighter. Okay, let's start. So World Health Organization defines health as a state of complete physical, mental and social well-being. You have to be physically, mentally and socially well. Only then you can be termed as a healthy person. That's one interpretation. Even Amartya Sen said that health is a social good. What he exactly meant when he said health is a social good is, if you are healthy, then you automatically be an asset to a society. Your social participation would automatically increase. So as a result, according to Amartya Sen, I have not written here, just write it down. जो भी मैं extra बोल रही हूँ, you have to write it. So according to Amartya Sen, it says that health is nothing but social good. Because if a person is healthy, automatically the contribution, participation to the society significantly improves. Social good का मतलब होता है जब आप society के लिए you do something right, something good for the society. So that is why it says that health is a social good. Who said that? Amartya Sen. एक लाइन है यार, लिख लो जल्दी से. Amartya Sen says health is a social good because if a person is healthy, then he significantly contributes to the welfare of the society or participates actively in the affairs of the society, in the social affairs, whatever you want to write. I am taking a break for 2 seconds so that you can condense the information. Next thing, it says determinants of health system. Now, when I was writing or making this material, I thought one perspective I'll give on the paper and the next perspective would be I'll deliver in the class. If this is my healthcare system, health, there are certain determinants which will define whether I will be having a healthy society or not. That aspect is known as determinants of health. So just look at the content. Do you want me to thoda sa essay? Ab dekho. The first line, determinants of health are the conditions in which people are born, they grow, they live, work, age, distribution of power, money, resources, everything which is impacting all these conditions are nothing but the determinants of health. Why am I telling you is that the overall health is a comprehensive topic. It's an umbrella term. Just by ensuring a good health infrastructure, a decent health workforce would not guarantee that you are going to be a healthy person or your society is going to be healthy. There are many determinants of health. For example, social determinants of health. Abhi recently, just 10 minutes back, a student asked me a question that occupational, मैं क्यों बोल रही हूँ, बस अब वही वाली बात है ना कि classroom lecture में I used to discuss all these experiences, so I'm discussing. So on Telegram I got a question. I hope जिस भी student ने भेजा होगा, if the person is watching this lecture. So the student asked, occupational specialization has diminished. I'll repeat, occupational specialization has diminished. So is caste relevant today? So to which I answered, caste is very much relevant because see, even though occupational specialization has diminished, there is a problem of manual scavenging which is still persisting. And the root cause of manual scavenging is what? Caste. So if caste discrimination is persisting, that means a certain person is forced to perform the job of manual scavenger. Now, if you are cleaning the septic tanks, if you are cleaning the sewages, if you are there are unsanitary toilets, you are cleaning the human sled, are you getting the point? You are more susceptible or prone to the diseases. So that is social determinant of health. That is what I was trying to convey. I am providing you good healthcare services. I have a lot of doctors, nurses, everybody is working. Okay. But what if the society is marred by the problem of casteism? If the society is marred by the problem of communalism? If there is a problem of patriarchy in the society, are you getting my point? In this situation, these marginalized, vulnerable sections will always be more exposed to the harm which will lead to the health problems. So this is what I mean when I say social determinants of health. So if you want to ensure healthy society, you also have to ensure socially more equitable, inclusive society where such kind of discrimination does not exist. For example, you are living in slums. Okay. Now, if you are living in slums, you do not have access to proper sanitation. You do not have access to safe drinking water. Okay. So as a result, you become more vulnerable. अब देख लो COVID में, if you are living in a slum, obviously the chances of you inviting the disease or catching the virus is more prominent. Why? Because social distancing is not possible. Physical distancing is not possible because you're already living in those what you call clammed and claustrophobic, dilapidated areas. So here social determinant also become very important. So did you understand what is the first topic I'm dealing? Initially I began with a quotation. Then I told you need to understand what exactly is the concept of health, how comprehensive or an umbrella term it is. The next topic that we are talking about and why are we discussing is that if I have to ensure healthy society, you first need to understand that what all are the determinants of health, what are all the factors which is impacting the health of a person. And if you are able to address all those factors, automatically the society will become healthy. So first determinant of health is social determinant. See, content आपके पास सब कुछ है, बस सुनो. Just listen it as a story, and wherever it is required to write something, I'll tell you. ठीक है? So is social determinant clear for everyone? Then comes ecological determinant. अब ये तो आपको खुद ही पता है ना. See, India is more prone to diseases because the climate is such. ठीक है? And not only the climate, the problem here is that there is so much of variation. There is over exploitation of the resources. So many a times we have seen that there are a lot of diseases which are born due to ecological factor. For example, if your environment is not clean, if I talk about pollution, you have air pollution, okay? So that can also be one of the factor. Then because of the change in the climate, sometimes there is rainfall, sometimes there is no rainfall. So food insecurity is there. If you have consumption of less food, less nutritional food, automatically you would be suffering from problem of hunger or malnourishment. Are you getting my point? I'll repeat myself. See, climate change हुआ, too much of rainfall हो गई, या for some years rainfall did not happen. Most of our agriculture is dependent on rainfall. हमें पता ही irrigation facilities are weak. As a result, the food production was less. Automatically prices increased. अब ये सब तो आपको मैं कितनी बार पढ़ा चुकी हूँ. I hope you are understanding what I'm trying to convey here. ठीक है? तो अब जब food prices increases, as a result, you are not getting sufficient food to consume. If you're not getting sufficient food to consume, you are suffering from malnourishment. You are not getting nutritious food. So as a result, your health over a period of time will deteriorate. So ecological factors are also determining the quality of the health. Is that very clear? Making sense for everyone. Okay. Now, next is economic determinant of health. अब ये तो सबको पता है. मुफ्त में इंडिया में you will not get anything, and especially healthcare services. Most of the healthcare services is privatized, and since most of the healthcare services is privatized, you need money to ensure better accessibility to the healthcare system, and that is also one of the challenge. Is that very clear? So if you are poor, then automatically the availability, ये 4 words I know that you would be remembering if you've seen my previous lecture. I'll just repeat. कहीं rough में just very quickly write down. 4AQ. Availability, accessibility, affordability, awareness, and quality. I'll repeat. Availability, accessibility, affordability, awareness, and quality. ये लिख लो कहीं रफ में. I'll be using these terms again. ठीक है. Now, if a person is poor, automatically the availability, accessibility, affordability, even the awareness about the healthcare system also declines. So the chances of being unhealthy is very high. Suffering from some kind of morbidity or the mortality rate automatically increases. So economic determinant of health is also very important. If a person is poor, देखो उसके बहुत सारे factors हैं. If a person is poor, automatically he will not be able to access healthcare system. That's one reality. If a person is poor, automatically the person will be living in such areas which are not healthy. For example, slums. I've already given you that example. If a person is poor, automatically the person will not have access to nutritious food. So in all the 3 circumstances, the chances of being unhealthy would be very high. Is the story clear for everyone? Do you want me to repeat? Lit lo kahi. Just make the connections. It makes your work easy. So if a person is poor, first challenge is accessibility, affordability of the healthcare system. If a person is poor, the person would be residing in those areas which are not healthy for habitation. For example, slums. They would not have access to basic survival services. Then it can also be, third point, they do not have access to nutritious food. So everything is boiling down to economic determinant of health. I hope this is clear for everyone. Can I proceed? 2 seconds. Just let the information condense, process in your mind. ठीक है? Next. Population stabilization. यहाँ पर है यार, हम यहाँ पर हैं. We are here. Population stabilization. ठीक है? Automatically, see, if the fertility rate is high, if you have too many kids, automatically the resource gets distributed. And when the resource gets distributed, not a single person gets sufficient resources which are required to lead a healthy life. So population stabilization also becomes an important determinant of health. Often it is seen if the fertility rate is high, then the chances of child malnourishment is very grave. If you have studied, I have already discussed in society lectures with you fertility rate के implications, and I told you resource deficit, attention deficit, chances of malnourishment, the worst sufferer is a girl child. So in all those situations, even population stabilization, why it is required with respect to the health of the women. The women health gets compromised. So in all this capacity, population stabilization is also a determinant of health. Then community participation. What I exactly mean by community participation is, I'll give you an example. I don't know whether I have said this statement before. मुझे लगता है I would have said in some of the other class. There's one of the statement which is written in NCERT that you cannot blame state for every problem. The state cannot be held, write down somewhere, state cannot be held responsible for social change every time. State cannot be held responsible for social change every time. And no section, howsoever weak it is only a victim. लिख लो statement, I'll explain. State cannot be held responsible for social change every time. And no section, howsoever vulnerable it is, can only be a victim. कहने का मतलब है, every time you cannot, अब देख लो what is the situation during the time of COVID. You cannot blindly blame government for it. Even today, I went outside for some work. I was so stunned. People are just not following the rules. They are not following social distancing, they're not wearing masks, and since the lockdown is open just to ensure that the economy keeps on moving, people have just forgotten that there's something called COVID even exists. You cannot be so irresponsible, and every time you cannot blame state. So community participation is the need of the hour. NGOs, civil societies, they all have to come forward. You and me have to come forward. Even our Prime Minister has said we have to become Atmanirbhar. So the point here is community needs to come forward and participate. Is that very clear? कहते हैं ना कि लोगों को देखकर you tend to, if you set a good example, the chances of people copying you or drawing inspiration from you can be very high. So community can come forward, they can participate in physical activities, they can participate in changing the mindset of the people with respect to health. It can change the mindset of the people with respect to their lifestyle. So many a times community participation can also ensure good health. So that is also one of the determinant. Is that very clear? Okay. Then obviously private sector, civil societies, global partnership, all of that is very important. Because every time the state cannot provide you the resources. तभी तो हम बात कर रहे हैं national health policy में public-private partnership की. That they have to come forward, they have to take part in providing health infrastructure, in providing robust health infrastructure, and everything cannot be left on the government alone. And absolutely last but not the least and the most important, governance. Every time we come up with a scheme, but when we talk about the implementation of the scheme, neither we have good mechanism for identifying beneficiaries. There is misappropriation of fund, there is corruption, there is red tapeism, lack of transparency. Agar PABAD optional hai, even ethics mein administration you've studied, you know all the points. So governance is the most important determinant of health. A good governance can shape the entire health system of the society. I would not comment anything beyond that, but you know what I'm talking about. So governance is very much required, and not only with respect to the health system. If your governance is robust, automatically every other scheme will fall in place. Whether it is midday meal, whether it is ICDS, whether it is targeted PDS, are you getting my point? Whether it is Ayushman Bharat, whether it is Swachh Bharat mission. So if your governance is good, every scheme fall in place. And if every scheme fall in place, so all the determinants of health, social, economic, ecological, population stabilization, everything would be taken care of. So governance is like the frame or that thread which is holding everything together. If governance goes wrong, everything falls flat. So yes, governance is very important determinant of the health. I hope the point is clear for everyone. I have given the detailed content, but did you understand the perspective that health is a comprehensive issue, and in order to ensure good health or healthy society, you not only have to focus on health infrastructure, you not only have to focus upon establishing colleges, hospitals or health workforce, you also have to take care of all other determinants of health: social, economic, ecological, population, community, private participation, governance, whatever. Is that very clear for everyone? अब मेरा perspective आपको clear होगा कि मैंने ये क्यों बनाया. I hope it is clear. Okay. Now, that's one side of the story. There is another side which I wanted to discuss and I have not written in the content. So let's very quickly. अब आपको थोड़े से notes बनाने हैं. या देखो, if you will not make any notes now and you will just depend upon whatever I'm saying in the lecture, थोड़ी देर बाद you will zap out. तो थोड़ा सा let's be physically active. Pick up a pen, a paper, and start making notes. I'm not dictating. Just write whatever you feel like is important. See, that's one aspect. Okay. What if the question comes, why it is important for a society to be healthy? What good is healthy society doing? So you should also be aware of. These are the one side of the story, that all these are the determinants of health. Once you establish a healthy society, how it is going to contribute, that also needs to be studied. For example, I've already told you, health is a social good. Matlab, Amartya Sen, I've already repeated this, that if you are a healthy person, then automatically your participation in the society will increase. I'll give you an example. Suppose you are healthy. If you are going to school, ठीक है, if you are healthy, that means your learning outcome will be better. If your learning outcome is good, whatever skill has been taught to you, you will understand the skills better. And as a result, since you are educated, you're skilled, you're healthy, automatically your contribution in the society will significantly improve. That is why it is said, health is a social good. समझ आया? Next, health is a political good also. If you are healthy, I'll again trace. If you are healthy, ठीक है, your learning outcome is good. ठीक है, you are getting access to good content, you're reading rational content and everything. I will not get into rationality aspect, but at least you are aware because you are healthy, you're a person of sound mind. So basically, you are getting access to the content which is available, you're reading stuff. So as a result, you are an active citizen of the country rather than a passive citizen. Because now you will actively participate in the political affairs of your country, whether it is voting, whether it is challenging anything which is going against democracy. So in every which capacity, if you are healthy, you are a person of sound mind. I told you now, healthy is a broad topic. It's a state of social, mental, physical well-being. You're mentally fit, you're physically fit, you're socially fit. Automatically you're actively going to participate in the political affairs of the society. लिखो कहीं पर जल्दी से. Health is a political good. That is active participation of people in the political affairs of the country. Active participation of the people in the political affairs of the country. Next, write down. Health as a political good enables, health as a political good enables the political discourse. Health as a political good enables the political discourse, matlab political process, political discourse to become more democratic, accountable and decentralized. More democratic, accountable and decentralized. See, if you're healthy, if you're participating in political process, automatically the entire process will become democratic. You will hold your government accountable. The governance would become decentralized. Is that very clear for everyone? I hope it is clear. Okay? Next, health as an economic good. See, if you are healthy, that means I already told you that you will be able to adapt to the skills. Okay, your learning outcome is good. Automatically, your economic productivity will increase. Your efficiency will increase. And as a result, you will be an asset to the economic aspect of your country. Right now. Health as an economic good. It relates to economic growth and prosperity. It relates to economic growth and prosperity. It ensures healthy workforce or healthy individual ensures better productivity, better decision making, more efficiency. Better productivity, better decision making, more efficiency. Am I clear on this? Next, health as an ecological good. Health as an ecological good. See, if you're healthy in complete sense, in total sense, automatically you will be more positively disposed or inclined towards sustainable development, sustainable consumption, environment-friendly policy making. So it will be acting as an ecological good. Likho jaldi se. Health as an ecological good. Health as an ecological good results into sustainable development, sustainable consumption, and environment-friendly policy making. So in every which capacity, having a health, नहीं, ये लिखना नहीं है, ये मैं बोल रही हूँ. So in every which capacity, having healthy society is just a win-win situation. It will strengthen your social milieu. It will strengthen the political process. It will contribute positively to the economic growth, it will also sustain the environment. So yes, it is very important to have healthy citizenry. And to have a healthy citizenry, we have already discussed the determinants of health. I hope this one aspect of the topic is clear for everyone. Now we will begin with another thing, that although we have discussed, now prima facie what is important to look at is what is the current status or how the healthcare system operates in India. So here we would be talking about the infrastructure, challenges, government efforts, what more needs to be done. Okay? Chalo. Take 2 seconds and just condense whatever information I have given to you, and then I will be beginning with healthcare infrastructure in India. So I hope you've been able to condense the information which I've provided. Let's continue. So the first topic that now we are going to take up is health infrastructure overall. If I talk about healthcare system in India, it can be divided into 3 parts. There are 3 tiers. So first is primary healthcare, secondary healthcare, and tertiary healthcare. And if you look at the content, the most important healthcare system is primary healthcare in India. Okay? But overall, the healthcare ki agar baat kare, so the most important, the foundation of a good healthcare system is primary healthcare. But irony is that India's weakest healthcare is primary healthcare. Okay? So very quickly, just look at what is being given here. I hope you can see. So let's start with primary healthcare. Primary healthcare, Alma Ata Declaration, 1978. Kuch nahi likhna. Everything is there in the content. So Alma Ata Declaration, 1978. That was the declaration for the very first time. It recognized the importance of primary healthcare, and they have clearly defined what constitutes primary healthcare. In fact, 2018 was the 40th year of Alma Ata Declaration, and there was another declaration which happened and which was known as Astana Declaration. ASTANA. तभी मैंने कहा था previous year PT 365 also just go through it. So there it is, Astana Declaration. कभी कभी ना what you get in prelims is match the following. So for example, Yogya Karta principle. It is related to what? ठीक है. So it talks about, or for that matter, Beijing Declaration. So Beijing Declaration is related to women empowerment or equality and all that stuff. Yogya Karta is with respect to transgender. Okay. So then you have Astana Declaration or Alma Ata. So you should be aware that it is related to what? Primary healthcare. Sometimes you get such questions. So you should be prepared for that. Anyway, just forget that. Let's talk about, so Alma Ata Declaration of 1978 for the very first time had identified primary healthcare. Now, read the next thing. WHO has basically given a cohesive definition as far as primary healthcare is concerned. Just read here. Meeting people's health needs through comprehensive, it talks about comprehensive healthcare. You have promotive, protective, preventive, curative, rehabilitative and palliative care throughout the life course. मैं एक आपको एक चीज बताती हूँ. There is a concept you would be discussing or you must have heard about many a times. That is universal health coverage. हम बात करते हैं ना, सुना भी होगा. Universal health coverage talks about this aspect only. That health services should not only be curative in nature. First of all, you should promote good health. You should already tell people how can you be healthy. So promote, prevent any kind of morbidity or any kind of mortality for that matter. For example, I should provide you safe drinking water. I should provide you safe sanitation. Automatically, I am preventing the probability of diseases. So promotive care matlab you should follow hygiene. Okay, that is promotive care. You should eat nutritious food. You should not drink beverages or smoke tobacco or all that stuff, cigarettes and everything, sugar drinks or fat-laden food. You should not do that. So I am promoting good health. But then I'm preventing diseases by providing you safe working environment, safe drinking water, proper sanitation. So that is preventive. Then protective, as in case something happens, then I have to provide you healthy environment. Okay? Then curative. Suppose you're already suffering from a disease, then I need to cure you. Once I have cured you, I need to make sure you are rehabilitated in the society. And then we have the palliative care. Okay? So basically, you have to prioritize all these things. It has to be a continuum of care and it should not only be curative in nature. I hope you got the point. Okay? Next. You already have the content. Don't sit without the content. Okay? Just keep highlighting. Okay? Then broader determinants, addressing broader determinants of health, which we have already talked about: social determinant, economic determinant, environmental determinant, even your behavior, lifestyle. That needs to. अब हमने एक बार पढ़ा था ना society में McDonaldization of food habits. Okay, so that behavior needs to undergo a change. So that's a determinant of health. Then empowering individual, families, communities to optimize their health as advocates for policies that promote, protect health and well-being. Is that very clear? हम कभी prioritize नहीं करते हैं अपनी health. Have you ever noticed? See, COVID के time पर, for us it is important to go out, meet people, because everything you think that if you are not the one, you will not be affected by COVID. हमें नहीं होगा. You must have heard this many people saying, अरे हमें नहीं होगा. Are you getting the point? Because you don't prioritize. कभी आपने सुना है that every 3 months your parents are going for health medical checkup? अरे कुछ नहीं निकलता है. There is a one long list of all the tests and medicines which are given by the doctor, and there is nothing in those tests. Are you getting the psyche that we have? You are not happy that nothing has been diagnosed, you're perfectly fine. You're upset about the fact that you got so many tests done, and still not even a single disease came. What was the point spending 5,000 rupees on that? Are you getting the point? You never prioritize your health. You take health for granted, and that is what is the major reason that despite having so-called services whatsoever we have, we are not able to ensure healthy society. Is that very clear? Now, so the cohesive definition given by WHO as far as primary health is concerned in general, I've already given it to you. This is how they have mentioned. Then what primary healthcare looks like? You have health and wellness center. You have a primary health center. Within primary health center, you have sub-centers. Within sub-centers, you have auxiliary nurse midwives. You have ASHA workers. And now you also have male health workers. Patriarchal society hai. ASHA workers cannot go and tell a male that, listen, this is how sterilization has to be done. You have to wear condoms if you want to go for population stabilization. They cannot. In patriarchal society, the females, they have a certain distance from the other counterparts, and most importantly, they're not open to talk about all the reproductive rights, behavior, sexual rights. So in that situation, it is very important to have a male health worker. Is that very clear? So that has been taken care of. So primary health center consists of health and wellness centers. You have sub-centers, auxiliary nurse midwives, ASHA workers and male health workers. This is just a chart understanding that what all constitutes primary health. Is that clear? Now, you can get a separate question. In fact, you would be surprised. Surprised to nahi kahungi. The last year there was an essay topic that primary healthcare and primary education are the major challenges of Indian society. See, so pata hona chahiye what is primary healthcare all about. So Alma Ata Declaration, clear for everything. Primary healthcare forms the foundation of the entire healthcare system. If it goes weak, automatically the pressure on secondary and tertiary care increases. और बहुत ऐसी चीजें होती हैं जो प्राइमरी हेल्थ केयर पे ही सॉल्व हो जाती हैं. सपोज करो ये एक प्राइमरी हेल्थ केयर सेंटर है, तो एंड यू हैव अ set of people here. Nurse midwives are there, ASHA workers are there. So nutrition, safe drinking water, any kind of first aid which is supposed to be given. Then institutional delivery, then immunization, vaccination, all kind of supplements. So all of that is provided at this level only. So if the major health problems can be resolved at primary level, the problem is when your primary health care system is weak, then you do not get aid or services at an early stage. Then chances of a small health issue getting blown out of proportion becomes very high. And then automatically your health also suffers and the pressure on secondary and tertiary care also increases. So primary health care is the foundation stone. It is very important for a robust healthcare system in any country. Is that very clear? Read. Importance of primary health care. There is a global evidence that primary healthcare is critical to improving health outcomes. It plays an important role in prevention of several diseases, especially non-communicable diseases, lifestyle diseases to be very precise. ठीक है, heart problem है, रेस्पिरेटरी प्रॉब्लम है, डायबिटीज है, ये सारी बेसिक हेल्थ केयर सर्विसेज कैन बी प्रोवाइडेड एट प्राइमरी हेल्थ केयर लेवल. दे कैन टेल यू व्हाट नॉट टू ईट, व्हाट टू कंज्यूम, गो फॉर फिजिकल एक्टिविटीज, टेक केयर ऑफ योर सप्लीमेंट्स. ऑल ऑफ दैट इंफॉर्मेशन कैन बी गिवन एट प्राइमरी हेल्थ लेवल. You don't need a specialized doctor for that. Is that clear? It reduces morbidity and mortality, and that also lower cost way. See, primary healthcare is provided by the government. If you talk about private sector provides you care mostly at secondary and tertiary level. Primary healthcare is often being provided by the government. So automatically the morbidity का मतलब होता है disease. So morbidity and mortality is being addressed at a very lower cost, and it reduces the need for secondary and tertiary care. This is what I was talking about. It also addresses preventive, promotive, curative, rehabilitative, palliative aspects of the care. And most importantly, it is essential in achieving sustainable development goals as well as universal health coverage. I hope this is clear for everyone. मैंने सब कुछ आपको इसीलिए दे दिया. जो भी एक्स्ट्रा इन्फॉर्मेशन है, आई एम गोइंग टू डिस्कस इन द क्लास, बट दिस इज बेसिक. दिस इज द कंटेंट आई हैव ओनली प्रिपेयर्ड. सो यू कैन रीड थ्रू दिस. इज दैट वेरी क्लियर फॉर एवरीवन? ठीक है. सो इंपॉर्टेंस ऑफ प्राइमरी हेल्थ केयर इज एस्टैब्लिश्ड. The most important catch here is the primary healthcare system in India is the weakest link. Am I clear on this? Can we proceed? I hope you got it. Secondary and tertiary healthcare, there is nothing to read here. As in nothing in detail is required. Secondary healthcare refers to the second tier of healthcare system in which patients are referred from primary healthcare to the specialist in the higher hospitals for treatment. In India, health centers for secondary healthcare includes district hospitals, community health center at block level. That's it. Repeat. देख लो, सामने दिया हुआ है. Secondary and tertiary में it is basically the referral cases, the cases which are referred from the primary care, or the cases which are not being taken care at the primary care level are transferred to the secondary and tertiary level. Is that very clear? ठीक है. So secondary care, it consists of district hospitals, community health centers at block level. Tertiary care is the third level of the health system. It is the specialized care. So all the specialized intensive care, the specialized hospitals, the medical personals, the advanced support system is being provided here. It is provided by the medical colleges as well as advanced medical research institutes. Is that clear for everyone? ठीक है. चलो, सेकेंडरी और टर्शियरी में इतना डिटेल में जाने का जरूरत नहीं है. जो बहुत सोर्स है वो प्राइमरी है. क्यों इंपॉर्टेंट? आई टेल यू वन मोर रीजन. नेशनल हेल्थ पॉलिसी वाज इंट्रोड्यूस्ड इन 2017. आपके PT 365 में द मटेरियल इज गिवन, एक बॉक्स में इट इज गिवन देयर. सो नेशनल हेल्थ पॉलिसी सेड व्हाटएवर एक्सपेंडिचर द गवर्नमेंट इज मेकिंग ऑन द हेल्थ केयर सिस्टम, 2/3 of that should be spent on primary health care. Because if you have a robust or strong primary health, automatically the pressure on secondary tertiary healthcare will decline. Is that very clear? That's why primary healthcare becomes very important. So it talks about promotive, preventive, protective, curative, rehabilitative, palliative care. It talks about more determinants, broader determinants of health. It also talks about community participation. It also talks about behavioral change in the individual families so that they can prioritize health. And they can emerge as co-developers of health and social services. Atmanirbharta, self-care. Anyway, let's continue. Okay. India has made certain progress as far as accessibility, affordability, availability is concerned. This is just the data. Data to support your arguments. For example, MMR has reduced, IMR has reduced, crude death rate, birth rate has reduced, life expectancy has increased. See, I've written everything. ये data है, ये याद कर लेना. IMR तो पता है ना कि number of children dying before the age of 1 per 1,000 live birth. पता कर लो यार, ठीक है. Then you have MMR. MMR has reduced to 122 per 1 lakh live birth. Number of female dying either during the pregnancy or giving birth or post the delivery per 1 lakh live birth is known as MMR, maternal mortality ratio. Clear hai? Then life expectancy has increased from 58 to 69. India has successfully eliminated smallpox, neonatal tetanus, polio, and all that stuff. So that's a good thing. Okay. Okay. Next. India has largely achieved Millennium Development Goals. Oh, ये पता है ना? Millennium Development Goals were set in 2000, and the goals were set as a target was there for 2015. Then in 2015, a new set of targets came, which is known as Sustainable Development Goals, which you have to achieve till 2030. So Millennium Development Goals mostly we have achieved, and is committed to universal health coverage. What exactly you mean by universal health coverage is, I'll just make a definition here. ध्यान से सुनना. Universal health coverage says that irrespective of your caste, class, gender, you will get access to good, affordable, qualitative healthcare. This is first interpretation of universal health coverage. Write it down. Don't look at my face. Right? Irrespective of your class, caste, gender, religion, you will get access to good, affordable, qualitative healthcare. First interpretation. Second says that the healthcare would be comprehensive in nature. It will focus on promotive, preventive, curative, rehabilitative healthcare. Is that very clear? Okay. So these are the two interpretations as far as universal health coverage is concerned. Is that very clear for everyone? Next, health financing in India. This we already know. Public expenditure की बात करें, so 1.2% of GDP, that is the government spending on health infrastructure is 1.2% of GDP. That means the remaining expenditure is met out of pocket. In fact, there is one data that we have that approximately 60%, that is it's there I think 58.7%. So approximately 60% of the expenditure on health is met by the individuals like you and me, and that constitutes out-of-pocket expenditure. The expenditure which is heavy on your pocket, and you know the data says, World Bank says that out-of-pocket expenditure is responsible for 1/6 of India's poverty. Likh lo, don't look at my faces. There's some data which I've not given, so write it down. पढ़ाते पढ़ाते याद आ जाता है. So World Bank says that out-of-pocket expenditure is responsible for 1/6 of India's poverty. And how much is the out-of-pocket expenditure? 58.7%. That means the government spending or the government expenditure is very less. That needs to be increased. Is that very clear for everyone? Making sense? Okay. So I hope all the three tiers, primary, secondary, tertiary, is clear. What is the importance of primary healthcare? That is also clear. Alma Ata and Astana declaration that we talked about, you understood that. Then we have generally mentioned that what are few achievements that India has made as far as health statistics is concerned. IMR, maternal mortality, life expectancy, birth rate, death rate, or for that matter, eradication, elimination of diseases for that matter. Okay, so we have talked about that. Okay, health financing, overall we understood the picture that the government spending on health is not sufficient. It is just 1.2% of the GDP. In fact, National Health Policy says it should be increased to 2.5%. But ideally the situation should be, it should be somewhere between 5 to 6% of your GDP, but anyway, forget about the ideal situation. At least it should be increased to 2.5%. The major factor of expenditure or the contributor to the expenditure on health is out-of-pocket expenditure, which is met personally by the individuals. And as a result, it is responsible for 1/6 of India's poverty. Who says that? World Bank says that. Is that very clear for everyone? Can we proceed now? I hope it is clear. So the next topic that we are going to take up is challenges faced by the healthcare system in India. So we'll discuss 3 more things now. Challenges, what are the government efforts or schemes, and what more needs to be done. And with that, health as a topic comes to an end in some time. And there is one small topic here, that is SDG goals. Kuch extra information hai TB or HIV को related that you can read on your own. ठीक है? चलो. 2 seconds low, just condense the information and we'll get back again. Okay. So I hope you have condensed the information which is provided. So let's start again. So the topic that we have to take now is challenges or the issues which is confronting the healthcare system. Standard topic hai yaar. If you get you ever get any essay or for that matter even GS questions, it can easily be answered. Okay. So if you talk about challenges, the first is inadequate health infrastructure. There is no rocket science involved here. I hope all of us know about it. Just a sec. Yes. So challenges. So first is inadequate health infrastructure. If I talk about the bed density, as in the hospital beds, so in the country it is zero point 0.7 per thousand population, which is far below the national average. In fact, it is below the WHO benchmark, which is 3.5. And you can face the brunt of this situation, especially in the COVID times. You might get a question with respect to pandemic COVID or how it has impacted the society at large, how it has impacted migration can be a probable topic, health infrastructure can be a probable topic, health being in the state list. What are the challenges at the implementation level? So that can also be a probable topic. So you have to be prepared for all of that. So if I talk about the bed density, see, I don't expect you to learn the exact data. But if I would have been there in your place, I would have definitely learned these data. The reason being, it gives credibility to your argument. The moment you write the answer, I will say that there's problem on hospital beds. And people say, oh, really? Matlab, WhatsApp se padh kar aaye ho? And then I'll be like, no, dude. I have the report, I have the facts. It is just 0.7 per thousand population, whereas WHO benchmark says it should be 3.5. You should be good with data. Okay? At least essay writing it gives you an edge over others. Anyway, jokes apart. Doctors ratio, 0.8 doctor per 1,000 population. In United Kingdom or for that matter, Australia or China. In fact, you would be surprised to know Cuban model की अगर हम बात करते हैं तो Cuba में it says that it is 8 doctors per 1,000 population. That's a significant data. In India, you've just 0.8 doctors. So there is a distribution, there is a skewed matlab uneven distribution of doctors. So there exists rural-urban divide also. In urban areas, if you have 3.8 doctors per 1 doctor in rural areas. So the problem here is not only quantity, the problem is also quality. I'll tell you how. Quantity, we have already talked about that for 1,000 population, you just have 0.8 doctors, which is comparatively less than other countries. That's one thing. The second thing, if you note here, or for that matter, there exists urban-rural divide. You have more doctors in the urban area. As a result, the rural people are deprived or they do not get access to a good healthcare system. But then there is another problem, and the problem is basically they do not have medical qualification. WHO has said that approximately 57.3% of medical practitioners in India do not have requisite medical qualification. They are nothing but quacks. QUACKS, quacks. झोला छाप, शुद्ध हिंदी भाषा में झोला छाप डॉक्टर हैं. And see the amount, 57.3%. And ये कौन है 57? Already the quantity of doctors was very less, hardly 0.8 for 1,000 population. And even in that, more than 50% of the doctors doesn't even have medical qualification. दिख ही रहा है वो तो क्या हो रहा है. So the status of health infrastructure is very weak. Either there is a problem of rural-urban divide, or there is a problem of quantity of the workforce. There is also the problem of quality of the workforce. Is that very clear? Then, India, ye to abhi recently, if you've read PT 365, it is there given that India has 20.6 health workers per 10,000 people, which is less than the threshold of 22.8. Is that very clear? Okay. In fact, drawing evidences from OECD countries, they have further revised the minimum need to 44.5 health workers. India में कितने हैं? 20.6. And what should be the minimum need? 44.5. Just half. And half, एक तो already half है, और उस half में से भी more than half doesn't even have medical qualification. So it is pathetic situation as far as health infrastructure is concerned. I seriously have a lot of respect for doctors, especially in this COVID scenario where I've seen a lot of them are working and they're trying to protect all of us, and we being irresponsible are not trying to take care. But at the same time, there are many people who are disguised as doctors and they do not have the medical qualification. So it goes both ways. So let's not blame any one side of the story. Is that very clear? So first is health infrastructure. Second goes less government spending, which we have already talked about. It's 1.2% of GDP, which is way less. Is that very clear? Then expensive private medical education. See, overall, National Medical Commission Act, जो pass हुआ था 2019, the act हम PT 365 में we have already talked about. So the one of the objective of National Medical Commission Act was to overhaul the medical education system. So that's very important, because see, the majority of the medical education is being provided by the private sector and it is very expensive. As a result, people go to other countries, whether it's Russia, China, Philippines, Nepal, to get access to medical education, and many times they don't find it lucrative because that's expensive. So they don't find it lucrative to come back to India and practice medicine. And most importantly, the acceptance of these doctors are also very less. So in that scenario, already the workforce is less, then all the more you have expensive private medical education. So in all this scenario, the workforce crunch further gets aggravated. So that needs to be addressed. So you can mention whenever you are discussing that one of the core objective of National Medical Commission Act is to overhaul the medical education system in India, to make it more qualitative, to make it more inclusive, to make it more affordable. I hope this is clear. Okay. Unaffordable treatments. There is no rocket science in that. एक डेटा दे देती हूँ इस पे, थोड़ा समझ पाओगे. I already told you out of pocket expenditure because government spending is very less, ठीक है. And private hospitals, एक act है 2010 का, Clinical Establishment Act. And Clinical Establishment Act basically talked about that all the hospitals, the private or the government, they have to provide all the essential healthcare services at an affordable price. ठीक है? मतलब the price should not be too much so that it becomes out of pocket to many. And the medicines that you are suggesting should be generic medicine and all of that. It should not be a branded thing. ठीक है? So all of that is mentioned under Clinical Establishment Act 2010. These are all extra information which I'm giving. So just listen. And if you find it important, you can make noting of it. So in that Clinical Establishment Act, the catch here is it is not implemented at pan-Indian level. The reason being, health is a state subject. So the center can only frame a larger policy. The implementation lies in the hands of the state. And not to our surprise, majority of the states have not implemented. Hardly 10 states, union territories have implemented this act. Otherwise, none of the other states have implemented this act. So that's the major challenge. You are not putting a cap on the amount of money these private hospitals are charging. It has more become like a business. I would not name, there are a lot of private hospitals in Delhi. As a reason, FIR has been registered. So I will not get into the debate whether FIR should have been registered or not or what. But I'm generally telling you that there are a lot of private hospitals which take undue advantage of this crisis situation, and so the people who can afford, they are affording, but there are many who are depending upon borrowings, or they come under some kind of debt. So all of that needs to be addressed. See, I've already given you the data. More than 24% of households in rural India and 18% of population in urban India have met their healthcare expenses through some kind of borrowings. It's a shameful situation. It should not be the condition. Health has to be a priority. Is that clear? It's not a luxury. ठीक है? Is that clear for everyone? तभी मैंने आपको सारा डेटा दे दिया है कि आपको कोई दिक्कत नहीं आएगी. इतना तो मैं आपका ख्याल रखती हूँ. चलो. Doctor-patient relation. See, एक दो चीजें हैं that it's mutual. So many a times we've seen, please don't take it personally. I know you must be very honest and your family members if they're doctors. That's a disclaimer. But there are many doctors who are not ethical. I already told you 57% they do not have medical qualification only. So there are certain doctors who are not ethical. As a result, the patient lose their trust in them. So that also becomes one of the reasons. When doctor asks them to conduct certain tests, हमें लगता है अरे commission होगी. When the doctors ask you to consume certain medicine, तो हम बोलते होंगे अरे इसका तो commission बंधा हुआ है. So that's a psychology. हम लोग बोलने लग गए हैं. दो लोगों से हमेशा बच के रहो. In fact, तीन. Doctors, police and lawyers, because they are there to snatch money from you. So that's a general perception in the society, but that needs to change. And at the same time, the patients also need to treat doctors as normal human beings. If they have failed to save life, so that's not because that they have not done their job properly. Maybe it was not possible to protect their life. But we have seen lot many patients, they attack the doctors. इसीलिए Healthcare Service Personnel and Clinical Establishment Bill 2019 has been introduced. I have discussed that with you in PT 365, where they clearly said that many a times the doctors have been attacked by the patients and they have faced violence, and majority of the cases have happened in ICU or emergency division where a person has not been able to save their life. Yeah, they're just people, they're human beings. They're not gods. I know that you treat them as God, which is good also, but in a good way. You should not create unnecessary pressure that if you're not able to save someone's life, you will just go on beating them. That's not the right way. So the doctor-patient relationship is also deteriorating. Okay, so that's more of a trust issue happening here. Then vulnerable sections of society, I already told you it's an expensive affair. So as a result, the availability, accessibility, affordability, especially to transgender, women, SC, ST, person with disability, that have become a challenge. Is that very clear? Then, health and vicious cycle of poverty. That's a major challenge. अब आपको याद हो जाना चाहिए vicious cycle बनाना. I have discussed so many times with you. So the cycle is right there in front of you. If a person is poor, obviously there would be paucity of resources. If there is paucity of resources, inadequate diet, nutrition, all of that would lead to poor health. If the health is poor, there would be high out-of-pocket expenditure. If high out-of-pocket expenditure, the productivity would be less. Automatically, you will be forced into poverty again. So that forms a vicious cycle. Is that very clear? That's right in front of you. You don't have to get into anything else. This is the basic understanding which you should focus upon. I hope this is clear. Okay. Then, neglect of traditional healthcare. What I mean is that Ayush has been neglected. Ayurveda, Unani, okay, yoga, so homeopathy for that matter, Siddha. So all of that has been neglected. The traditional medicine has to be reinvented. Research and development needs to be encouraged would be the right word. So yes, you need to encourage research and development in basically the traditional medicine, that is Ayush. Okay? It can, in fact, you can introduce bridge courses. Ek idea aaya bhi tha. The government did talk about bridge courses so that the problem of paucity of healthcare workers can be reduced. The people should be allowed to practice primary health care at least with certain exams. As in the traditional health workforce, the people who've been practicing traditional medicine Ayush, by providing them certain bridge courses, they could be allowed to act as a frontline healthcare service provider in allopathic field. Or you can develop Ayush as an alternative medicinal system to allopathy. And the reason people don't trust Ayush much is not much of research and development has happened, innovation has happened in this field. So that needs to be encouraged. More government funding has to be made in this area. Is that very clear? Okay. Next, less focus on preventive healthcare and research. अब भी मैंने बताया. The problem in our system is we are more focused on curative healthcare rather than preventive or promotive healthcare. If you have good working environment, if you have good living neighborhood, safe drinking water, sanitation, proper hygiene, nutritious food, and automatically the pollution, air pollution, noise pollution, all of that is not there. Your environment is sustainable, it's healthy. Automatically the chances of morbidity and mortality will decline. That's preventive healthcare system. And research and development we've already talked about. Inadequate health insurance. इस पे बताती हूँ. एक report है मेरे पास IRDA, your Insurance Regulatory and Development Authority. दिमाग से उतर जाता है यार. So IRDA, तो उनका एक रिपोर्ट आया था कि only 17% of Indians have access to some or the other kind of insurance. They were not even saying health insurance. They were saying some kind of insurance, which includes both health as well as life insurance. So IRDA, that is... So yes, Insurance Regulatory and Development Authority of India said only 17% of Indians have access to some kind of health insurance. As a result, many of the people do not have access to health insurance, because of which out-of-pocket expenditure is very high. Clear है? तभी Indians की कभी tendency देखना, जब तक completely आप बिस्तर नहीं पकड़ लोगे ना, you're not totally ill, that the pain is unbearable and it is very visible that you've become unhealthy and there's some major problem, you will never visit a doctor. छोटे मोटे चीजों के लिए तो आप parents are good enough. पापा सर दर्द हो रहा है, ये दवाई खा लो, बुखार है, ये ले लो, गला खराब है, take this medicine. So you don't even visit a doctor. And when you talk about no, I'm feeling very fatigued, very tired, there must be some problem. But nobody even bothered to get a full body checkup. There are so many things, vitamins, minerals, the essential things, components which are absent in the body, which needs to be taken care of. Because आजकल की food habits, lifestyle has completely changed. Many a times you're studying, but you're not able to grasp. You're sitting for 2-3 hours, and whatever you've read, you're just not able to recall anything. And then you think, what if there's some problem? Am I not interested in studies? Am I dumb? No, there is a problem where you're not able to, because there are certain essential vitamins, minerals which are missing in your body. Go get yourself checked. You will get to know there is some major issue. And immediately when you start taking supplements or any other natural way of providing those supplements to you, you will be hale and hearty. So the point here is lack of awareness. That is also one of the major challenges. Okay? Then challenges of non-communicable disease, lifestyle diseases. For example, cancer, diabetes. India has emerged as a diabetic capital in the world. It is expected by 2030, India would emerge as a diabetic capital of the world. मादा है हमने. We will emerge as the most populous country in the world. Now we have become the 4th most affected country by COVID and diabetic capital in the world. Though there are many achievements that we have made anyway, jokes apart. So challenges of non-communicable diseases is also one of the major reasons. It's a lifestyle disease, and the major challenges, it's not visible at a certain point. For example, just a sec, guys. Is that very clear? So, did you understand what we are discussing? So, non-communicable lifestyle diseases, you have cancer, you have diabetes, you have respiratory problem, you have cardiovascular, mental health disorders. Okay? So, then it, as well as to achieve universal health coverage with indigenous, see, I've written here, non-communicable diseases. Yes, you can read this. And you need to understand, you are in the phase of demographic dividend. If your working population is not healthy, if they are suffering from these lifestyle diseases, they would not be an asset for the nation. In fact, they would turn as a liability. So in order to ensure that you are able to reap the benefits of demographic dividend, you have to address the challenge of non-communicable diseases. So in order to prevent, you have to change the lifestyle. For example, yoga, meditation, physical activities, small steps, not taking a lift, going by stairs. These are small things. Taking public transport, walking as much as possible. Okay? So these are very few essential steps which is just need to change your lifestyle. And once you change your lifestyle, automatically the probability or susceptibility or getting affected by these diseases automatically declines. Is that very clear? Geography of India, which we have already discussed. The climate, subtropical climate, it provides ground for germination of diseases. And due to cumulative effect of poverty, population load, climatic factors, we are more prone to diseases. So हमें पता है कि climate is there और you cannot change anything. If it's a subtropical climate, it will remain that. What can be changed is that your lifestyle, the sources provided by the government, that can be taken care of. More awareness generation. Then lack of evidence-based policy making due to fragmented healthcare information system. Obviously, you do not have an online system. बहुत आए थे कि हम नेहा बनाएंगे. नेहा का मतलब था National E-Health Authority. फिर we talked about many things where we said that there would be a national health system, online system which would be created where at one place all your health stats, profile, data would be recorded, which can be accessed by the different doctors or people at different places. For example, मैं हिंदी में बताती हूँ. You visited a doctor, Hindi as in basic understanding. You visited a doctor. Doctor suggested you a list of tests and everything you got it done. Then he suggested you certain medicines and you did not find any relief. So you thought that you should go to some other doctor. The moment you went to another doctor, so again he would be asking you to get all those tests again. Why? Because the health information is very fragmented. So in that way, if there is an online portal where obviously it should be confidential, so if there is all the data, so the government would have access to the data and accordingly beforehand they can prepare the policy. For example, there was a data where it was found that majority of the people in the age bracket of 35 to 45 are pre-diabetic. Are you getting my point, what I'm trying to say? If you have access to that data, that means you are aware that in near future, the chances of these pre-diabetic patient turning into diabetic is very high. And diabetes is a major lifestyle diseases. That means you have to target audience and enable them or create an awareness that how they can reduce the chances of turning pre-diabetic to diabetic by improving their lifestyle. For example, yoga, meditation, or any kind of consumption or change in their food habits. So that is very important and that needs to be taken care of. And this is missing. Why this is missing? Because you do not have the health information system is very fragmented. So that needs to be taken care of. Challenges of hunger, we have already talked about. That's one of the major things. Hunger में हम already इसकी बात कर चुके हैं, ठीक है? Hunger is a major challenge, यार. In fact, if you remember, मैं फिर से repeat कर देती हूँ. Hunger में there was a concept of hidden hunger that we discussed, and just now I said there are essential vitamins, minerals missing from your body, so the probability of disease is very high. That is what I meant when I said challenges of hunger. Then next, you have challenges of sterilization. See, it's written here. Challenges of sterilization. That's just one aspect. If you want to avoid this, you can avoid this also. Sterilization, if you remember, we were discussing fertility issue. I told you about vasectomy, tubectomy. Remember that in most 97% of the cases is tubectomy. That is, women are getting sterilized. In fact, women's sterilization is a long procedure where the life is also under threat. It's a surgical process, whereas vasectomy is not life-threatening. But due to patriarchal nature of the society, vasectomy is not people do not resort to vasectomy. They more often go for tubectomy. And many a times we have seen that the sterilization camps which are there, there's lack of hygiene, lack of sterilized equipments are there. Even most of the doctors are quacks. Social auditing is missing. So in all that situation, the sterilization becomes a challenge. In fact, sterilization is just one way of population control. But the problem is due to lack of awareness, availability about alternative means, the major focus is on cesarean, surgical process of sterilization. Is that clear? So you can just very quickly. There is a lacuna in the formulation and implementation of initiatives which is marked by gender biasness. I told you, na, patriarchy is there. There is lack of choice. Information. I told you awareness की कमी है. ठीक है? Mostly it is focused on tubectomy. Is that clear? There are other methods such as condoms, pills, IUDs. They have not been focused upon. And why they are not being focused upon? The problem is primary healthcare system. Your primary healthcare is not there. You do not provide awareness to the people. See, if you're educated, you must be thinking, isme kaun si badi baat hai? See, if you're educated, you have access to content on the internet. You know there are alternative means. What about the rural women? They are suffering from the problem of patriarchy. They're suffering from the problem of poverty. They don't have access to these resources. All they know is about the surgical aspect of sterilization. So that becomes a challenge. Is that very clear? In fact, Chhattisgarh mein ek case bhi hua tha, where due to this lack of awareness, a lot of people died, a lot of females died because the sterilization camp, the equipments that were used were not sterilized properly, and because of that the women, they caught infection and they died. Many women died. I think Bilaspur district tha, ek baar confirm kar lena, Chhattisgarh state ki story. I think 2015 the case happened. A lot of women died. Is that very clear? Then challenges of malnourishment. We already know. Isme, yes, there is a data which needs to be corrected. It's not 9% of the children who are stunted, it is 39% of the children who are stunted. वो 3 missing हो गया गलती से. ठीक है, so it's 39% of the children who are stunted, 20.8% are wasted. हम stunting और wasting कर चुके हैं. Stunting is height with respect to age and wasting is weight with respect to height. That needs to be taken care of. Then issue of tobacco consumption, HIV, AIDS, ये आप छोड़ भी सकते हो. That's just extra information. Issue of sexual reproductive rights of women, this we have talked about, okay, in women empowerment and everything. Okay? So child marriage, female feticide, sex selection, menstrual health, hygiene, all of that becomes a challenge. There is huge variation across states. That is regional divide. There are few states who are doing well with respect to health outcomes, but there are many who are not. For example, Bihar, UP, no rocket science involved here. Then there are issues of regulation of food, drugs, diagnostic, life-saving vaccines. See, what I mean here is that mostly doctors are prescribing you branded medicine rather than generic medicine. In fact, once our Prime Minister also said that we'll make it compulsory for doctors to prescribe generic medicine, but that has not been materialized, as in there is no law here. So even today, doctors are prescribing branded medicine. So many a times it becomes very heavy on the pocket of the individual. So there are other associated problems with that. Is that very clear? Now, this tuberculosis impact of stigma, this I've given extra information. You can just read. There's nothing important here. Okay. So I hope you understood what I meant when I say challenges. If there comes an essay, now you have good amount of content. So whether it is weak primary healthcare, fragmented health information system, lack of health workforce, problem of finance, insurance, lack of awareness, lack of control over the reproductive rights of the women, or non-communicable disease challenge, everything we have talked about. I hope this is clear for everyone. Okay? Take 2 seconds to condense the information. Okay? So I will end this session on this note because I think there's too much information which I've conveyed. So on this note, I am ending. I'll continue with Sustainable Development Goal. I will discuss with you what are the government initiatives and what should be the way forward. And then we'll end the session. So as of now, I am concluding this session. So just read, listen to the lecture again. I have given you all the material. Highlight the important aspects in the material. And if you face any confusion, you need to get back to me. Hi. So how are you doing, people? So whatever we have discussed in the previous session, I hope everything is clear. Okay? So there are just 2 or 3 brief topics remaining as far as health is concerned. One is Sustainable Development Goal. Second is the government initiatives. And the next thing is what more needs to be done. Okay? So we would be sticking to that, and once that session is over, I would be bringing you another session that would be on education, and with that social justice would come to an end. So you need to understand that whatever we are discussing, you need to understand the perspective, you need to understand that whatever content is being delivered to you, how you are supposed to use that content in case the question comes either in the form of general studies question or it comes in the form of essay writing. So what am I suggesting you right now is that let me just finish health and education. That would be finished by tomorrow, and then what you need to do basically is that whatever is being taught to you in the class, whatever content is being provided to you, using that content, using that information as well as the thought process which goes behind that information, you have to try solving or attempting previous year questions. So what you can do, either pick up an essay or pick up GS question. The question would be there in GS paper 2, and then try solving that. In case you find any difficulty answering any of the question, you know where to contact me. You already have my email IDs, and I think many of you also have my contact number. So just feel free to contact and ask. Okay? So let's start. Assuming that whatever we have discussed in the previous session, that is what is the concept of health, how WHO has defined health, how or what are the various determinants of health, how health is an umbrella term which does not only mean that healthcare infrastructure or workforce has to be there, it has social, economic, ecological determinants as well. Okay? Governance or grassroots participation, all of that is a part of it. Then we did discuss the importance of good health, how health can act as a social good, which is a concept of Amartya Sen, then how it can act as political good, economic good, ecological good. We did discuss all of that. Then we discussed what are the challenges. We have also discussed the 3 tiers in healthcare system: primary healthcare, secondary healthcare, and tertiary healthcare. And in primary healthcare, we did talk about Alma Ata Declaration followed by Astana Declaration, which was signed in 2018 to celebrate or commemorate 40 years of Alma Ata Declaration of 1978. Then how WHO has given a comprehensive and cohesive definition of primary healthcare. We did discuss about that, right? Everything is right there. Okay? Then we talked about the challenges or the issues which are confronting the Indian healthcare system, and you have also discussed. Okay? So now, continuing that aspect, we'll quickly talk about the SEL or Sustainable Development Goal. Just wait. See, What I was trying to tell here is that when we discuss poverty, or I have discussed with you, I remember hunger. So I told you about that there is a technique to prepare sustainable development goal. For example, what is the goal? Sorry, guys. So, yes. So, what is the goal? So, basically, the goal is ensure healthy lives and promote well being for all at all ages. So, this is the goal basically. So, ensure healthy lives, promote well being for all at all ages. So, you should be aware about what is the goal. The first thing you need to talk about is it's not working for me. Wait. Let me just see if it's working for me, otherwise I will go in some other way. So first thing is goal. It will get deleted to just follow this. Okay. Then the second thing you should be aware about, which is written from here till, wait, it is written from this point till this point. These are the targets. It is easy if you can remember. So whatever we've written, these are the targets. For example, reduce the maternal mortality ratio to less than 70. Then you have end preventable deaths of newborns, children under the age of 5, that is neonatal mortality or under 5 child mortality. Then it talk about end the epidemics. Then reduce, see, I've written, everything is there. 1/3 premature mortality from non-communicable diseases. Then you have strengthened prevention and treatment of substance abuse. Then half the number of global death and injuries from road traffic accidents. Then universal access to sexual reproductive healthcare services, including family planning and all that stuff. So these are the points basically which are determining your targets. Very quickly, just highlight this. So first, I told you, you should be aware what is the goal. So ensuring, this is goal number 3, ensuring healthy lives, promoting well-being for all at all ages. Then you have certain specific targets. If you can remember, good enough. Otherwise, a brief idea should be there that it is targeting child mortality, it is targeting neonatal mortality or epidemics or maternal mortality ratio or road traffic accident. A brief idea should be there. Then comes the next part, that how can you achieve those targets? Okay. For example, how can we achieve those targets? So very quickly, just have a look here. How can you achieve those targets? So how can we do that? First, achieve universal health coverage, financial risk protection, access to quality essential healthcare services, safe, effective, quality, affordable essential medicines and vaccines for all. So this becomes a strategy that how would you, ये मैं आपको एक shortcut बता रही हूँ that how you are supposed to prepare SDG goals, because I told you initially also in the previous sessions when I discussed poverty and hunger, there was a question in 2015 that what are the MDG goals related to health and to what extent India has been successful. Now, SDG goals are still in process because the target is to be achieved in 2030. So they might ask you that how would you achieve those SDG goals? So either you can come up with your own answer or this is the answer right in front of you, that you need to achieve universal health coverage. You need to provide them financial protection. You can also talk about, remember in the last session 4AQ, availability, accessibility, affordability, awareness and qualitative services with respect to essential diagnostic or medicines or vaccines for all. So this can come as an answer. Similarly, what can you do? You can strengthen the implementation of WHO Framework Convention on Tobacco Control. Tobacco is one of the major reasons for cancer. So that can be written. Then research and development with respect to vaccines. See, COVID ke case mein, we are suffering so much because we don't have a vaccine. Then you can talk about communicable, non-communicable diseases. You can also talk about affordable essential medicines, that is generic medicine. Then you can talk about health insurance, financing. Okay? Then development, training, retention of health workforce. Keep highlighting. I have given a detailed content only because of this reason so that you don't face any problem. Are you understanding what I'm trying to convey here? And then strengthen the capacities of all the countries, especially developing, with respect to warning, risk reduction, management of national and global health risks. See, we already know in context of COVID, I would not get into the aspect, but yes, we could have controlled it. Have we got alerted a month earlier. But anyway, let's just not talk about it because there are a lot of political biasness or ideology might get into the process. But what I'm trying to say is that the capacity of all the countries needs to be strengthened so that there is early warning, risk reduction and management of any kind of national or global health risk. I hope you're getting my point, what I'm trying to convey. You have a goal, you have a target, and how to achieve the target. Right in front of you, the answer is there. Suppose karo, the question does not talk about SDG goal. Even then, all these points can be written as a way forward. For example, health coverage, health financing, communicable, non-communicable diseases, research and development. You can talk about vaccines, generic vaccines, WHO framework, or the capacity of the country with respect to early warning, risk reduction, all of this, or recruitment, training, development of health workforce. Answer remains the same. What I'm trying to convey, if you know my kind of pedagogy, you must be aware of it that you don't have to prepare enormous content. You just need to prepare limited content which can be used in different manner. I hope the point is clear that how sustainable development goal can be used in case the question comes with respect to health. Can we proceed? Now, the next thing which I have given here is Niti Aayog Sustainable Development Goal Index. This is there in your PT 365. So nothing as such is required. ये बस मैंने इसलिए दे दिया to give you an idea that this kind of index gives you an information or statistics that what is the current status. So with respect to maternal mortality ratio, the current status is it is 122. It has significantly declined, but SDG target says it should be around 70. So we still have a long way to go. So that needs to be addressed. Then under 5 mortality. Okay. So it has fallen to 37, but still you have a target to reduce it further to 25. So yes, you have a target to achieve. So all of this helps you giving credibility to your answer. That according to Niti Aayog's SDG India Index, current status of India's health is this. And then you can proceed what more needs to be done. Similarly, communicable diseases. Now, here India being the second most populous country. So all of this you just can read it. मतलब ये मैंने आपको content सिर्फ इसलिए दिया है so that you have certain fodder at your disposal that in case essay comes or answer writing comes, then you can make use of it. ठीक है? Now, what are the major health challenges which India is facing in general according to this Niti Aayog report? It is the same challenge which we have already talked about. Affordability, cost of healthcare is a major challenge. There is a large gap regional variation in best performing states and least performing states. So Niti Aayog का state health index report is there in front of you. ठीक है? Healthy states, progressive India हमने PT 365 में करा है. ठीक है? So there is a variation. For example, disparity that Uttar Pradesh is lowest in health index, whereas Kerala is on the top of the health index. एक second. This is written here. Uttar Pradesh and Kerala. So there is regional variation which is existing. There exists rural-urban divide. We have already talked about. Then lack of health awareness. That is a major thing. You are not aware about child and adolescent health. We are not aware about nutrition. We are not aware about the lifestyle issues. Then geriatric morbidity. Geriatric as in the old age morbidity. That as in when you are becoming old, the physical aspect, the mental, the cognitive faculties of the old person starts declining. So that also needs to be taken care of. Okay? So lack of focus on preventive care. So what I'm trying to tell you is that all of this is nothing new. But yes, Niti Aayog has talked about it. So it is right in front of you. Okay? So कहने का तात्पर्य यही है that the points remains the same. Now just forget everything. If I ask you what are the challenges, can't you answer? Your primary healthcare sector is weak. Privatization of healthcare, that means the cost is very high. Out-of-pocket expenditure is very high because public spending is very less. Since out-of-pocket expenditure is very high, it is responsible for 1/6 of India's poverty. With respect to health infrastructure or workforce, there exists regional variation. There exists rural-urban divide. Most importantly, both with respect to quantity, मैं कुछ नया नहीं बता रही हूँ, जो अभी प्रीवियस सेशन में बताया था बस उसको रिवाइज करवा रही हूँ आपको. So with respect to quantity as well as quality, remember quantity 0.8 per thousand है ना, is the number of doctors, and World Health Organization says that only 57.3 do not even have medical qualification. We did talk about it. The problem is health insurance, fragmented health information system. You and me do not have awareness about what constitutes good health. We do not prioritize our health until and unless we are too ill, that the illness is visible. We don't feel like visiting a doctor. There is no concept of pre-medical checkups and everything which exists. Are you getting my point, what I'm trying? The lifestyle disease, non-communicable disease is the biggest challenge which is emerging in the current scenario. The focus is shifting from communicable to non-communicable. But abhi wapas aa gaya. COVID is here. So did you get my point, what I'm trying to convey? Then problem lies with medical education. You do not have colleges. Then due to privatization of medical education, people are going outside to other countries. They don't prefer to come back. So there is a problem of dearth of medical practitioners in India. There is corruption, because of which National Medical Commission Act has been passed. Are you getting the point? More or less answer remains the same. चाहे वो नीति आयोग कहे, चाहे आप खुद कहे, चाहे वो नेशनल हेल्थ पॉलिसी में लिखा हो, आंसर रिमेन्स द सेम. आई होप यू गॉट द पॉइंट व्हाट आई एम ट्राइंग टू कन्वे हियर. वो मैंने जल्दी जल्दी इसलिए नहीं बोला कि I'm just trying to tell you all these points individually. We have discussed in the previous session. I am just trying to substantiate my argument that with limited understanding also you can answer. But anyway, this is not limited understanding. I've given you more than enough content. Okay, can we proceed now? Now, government initiatives. If I talk about government initiatives, see, if the answer comes with respect to mains, what I'm just trying to tell you here is that suppose करो you have some ये आप अपने PT 365 या फिर current affairs से you would be supplementing, ठीक है? Because otherwise it would have been a repetition. For example, national health policy. So national health policy, I already told you it's there in your PT 365 material. You will be looking at that, ठीक है? So national health policy talks about that you have to double the government spending from 1.2% of the GDP to 2.5% by 2025. That's a good thing. You are talking about increasing the public spending. Okay? Then, with respect to the issue of variations की अगर हम बात करें, so Niti Aayog in collaboration with Ministry of Health and Welfare and World Bank has created a health index जो अभी हमने बात किया SDG index की बात करी है, ठीक है? Health outcomes and progressive outcomes की बात करी गई है. The National Medical Commission Act, all of this in your PT 365. You just need to Ayushman Bharat. Ayushman Bharat has two components. One is Health and Wellness Center, where they have vouched that they would be establishing 1.5 lakh centers which would be providing you comprehensive health care, which would be including non-communicable diseases, maternal child health care, essential drugs and diagnostic services would be provided free of cost. So that is Health and Wellness Center. Then you have National Health Protection Scheme, Pradhan Mantri Jan Arogya Yojana, जिसमें हमें पता है कि वो 10 करोड़ households को target करेंगे and up to 5 lakh rupees coverage would be provided for secondary and tertiary care hospitalization. ठीक है? So is this very clear that Ayushman Bharat has two components? You have studied it. It is there in your current affairs. ठीक है? So then Right of Person with Disability Act. This we have talked about again in PT 365. Mental Health Care Act we have again talked about. Then you have Poshan Abhiyan, which talks about reducing the levels of stunting, wasting, low birth weight by 2022. Then you have Mission Sampark. Okay. So basically what I'm trying to tell you here is that these are government initiatives, and at least you should have awareness that these are the initiatives which has been taken up by the government in order to address the problem of health care, overall health care, whether it is nutrition, whether it is insurance, whether it is public spending, whether it is regional variation, whether it is mental disability, whether it is HIV, AIDS, or these efforts. Is that very clear? Okay. Then I have written all the government efforts which have been taken so far. This is in detail. For example, contraceptives, Antara and Chaya, fertility, population stabilization के लिए. Then there is Lakshya program which has been launched. See, it's written here. Lakshya program, it's written here. It is basically maternity care to all the pregnant women. Okay. Then you have contraceptives, Antara and Chaya. कभी कभी प्रीलिम्स में पूछ लेते हैं अंतरा एंड छाया आर व्हाट. तो ये कोई इसरो के एक्सपेरिमेंट्स नहीं है. अंतरा एंड छाया कॉन्ट्रासेप्टिव पिल्स. ठीक है. देन इफ यू रिमेंबर माय classes on fertility. I have told you about this. Reproductive, maternal, neonatal, child health and adolescent. This is the pillar, this is the strategy of the government to reduce or to address these issues. Is that very clear for everyone? Then Article 21, Puttaswamy case, it says that women's right to make reproductive choices is the dimension of personal liberty under Article 21. So they have the choice, that they have the right to make choice with respect to sterilization. I've already told you, if you remember population issues, we were discussing planning and I told you that how sterilization initially was focused on women, and it was basically during emergency when Congress lost the power. So the entire focus was shifted from male sterilization to female sterilization, and female have no choice because of the patriarchal nature. So in Puttaswamy case, Supreme Court has said that women right to make reproductive choices comes under personal liberty of Article 21, which is non-negotiable. ये prelims में सवाल बन सकता है. Is that very clear? छोटी छोटी चीजें, keep that in mind. Then World Malaria Report, ये तो देख लो यार. I'm just trying to give you और आशा workers, ठीक है? Is that very clear? These are certain extra informations which I have provided. Now, my concern here is that we need to go beyond this. Is that very clear? So basically, I hope this aspect is clear for everyone. For example, Swachh Bharat Mission. If I talk about Swachh Bharat Mission, it is also a means to address the healthcare problem. If you are promoting Ayush, it is also there to address the healthcare issues. Or WHO Framework Convention on Tobacco Control, 85% of pictorial warning on the packaging of tobacco products. तब भी लोगों को समझ नहीं आता है. I don't know what is their problem. So is this very clear? Then issue of, just a sec, issue of generic medicine. Okay, then Asha, we have already talked about. So I hope what are the initiatives taken by the Indian government is clear till here. Now the last topic, so we have talked about SDG goal, we have discussed goal, target, how to achieve the target, then we have talked about what are the initiatives taken by the government as far as healthcare is concerned, whether it is National Health Policy, Mental Health Care Act, Ayushman Bharat, or for that matter Poshan Abhiyan. We have talked Swachh Bharat Mission, we have talked about all this. This helps you writing the answer. For example, SMA, what are the government initiatives? There is always one para which is dedicated to this. So here you can mention on these efforts. And as far as prelims is concerned, PT 365 has already covered all this. Is that very clear? Now the last topic that is supposed to be considered is what more needs to be done. Okay? Chalo, let's take that. What more needs to be done? So the last topic that is supposed to be covered was the way forward. And now before we start with the way forward, something is written on the screen for you. That is what more needs to be done. That's there in your content. But before I discuss the cell, okay, chalo, let's start with this. I wanted to give you some extra points also. So let's first begin with this and then I'll give you more extra points. There is a concept which has been introduced in WHO guidelines. That's the concept of self-care. Now, just read it. Self-care would mean the ability of the individual, families and communities to access healthcare. It's a standard definition, with or without the support of the healthcare provider. It's a standard definition that self-care would mean that ability of individual, family, community, that whether they are able to access the healthcare with or without the support of the healthcare service provider. For example, मैं एक example देख बताती हूँ. जैसे there, why do you need for every small thing that support of someone? For example, pregnancy kits. So the pregnancy testing can be done at home also. Did you get my point? Sometimes there are self-injectable contraceptives for everything. अब जैसे insulin है. There are a lot of people who inject the insulin on their own. They don't need an intervention by the third party. So this is known as self-care. Are you getting my point? So taking the pills or contraceptives or injections. So that is self-assisted healthcare. That is known as self-care. But that does not mean that the doctors can be replaced. Absolutely not. But yes, definitely, by making these small interventions, the burden on the healthcare infrastructure or the system can be reduced so that it can be utilized for more grave issues rather than for these primary services. Let's see. Self-help would mean different things for people living in diverse conditions. For example, people belonging to upper strata. When you have easy access to healthcare system. Now, what do you mean? health self-care means access to healthcare. Now, if you have money, definitely you have easy access to healthcare. But then, how much your privacy is respected, whether that access was convenient or not, whether the access was easy, as in that was without any other kind of impediments. So that would mean self-care or self-help for upper strata people. But if I talk about the lower strata people, then access to healthcare is a challenge. So in that situation, whether the primary healthcare services are available or not, it is timely available or not, it is reliable or not, everything would come under self-help. Is that very clear for everyone? So this entire concept of self-care is very different for people belonging to different stratas. That is what WHO guidelines had put forward. So this concept of self-care should be promoted. It should be promoted across the classes. For example, for upper strata people, it should be more about convenience. It should more be about privacy. But for lower strata people, it should be more about time. It should be more reliable, qualitative. Primary care should be provided to them with easy interventions. So self-care or self-help means different things to people belonging to different strata. I hope this is clear for everyone. Then WHO guideline says, for example, सेल्फ केयर कहाँ पे सबसे इंपॉर्टेंट हो जाता है, दैट इज विथ रिस्पेक्ट टू सेक्सुअल एंड रिप्रोडक्टिव राइट्स ऑफ वुमेन. फॉर एग्जाम्पल, यू कैन clearly see here HIV self-testing, self-injectable contraceptives, self-management of medical abortion. When you've conceived a baby, you can have certain pills which can lead to medical abortion. Medical intervention is not required. So self-management. But what you need to take care is that self-care do not replace the health services. Neither it is a shortcut to achieve universal health coverage. I do not intend, or WHO do not intend to say let's promote self-care. आत्मनिर्भरता कर लो because हम तो कुछ कर नहीं पा रहे. Please don't take it otherwise. I am normally saying that self-care does not mean that we are going to replace healthcare system और अब हम कहेंगे कि हमने तुम सबको थोड़ा बहुत डॉक्टर बना दिया है. Now the doctors are not required. Absolutely not. Or if you're able to take care of yourself, we will not say that see universal health coverage has achieved. I have already told you in the last session what do you mean by universal health coverage. So do not tell me that you didn't understand the pun here. So is that very clear? Now guidelines look at the scientific evidence for health benefits of certain interventions that can be done outside the conventional sector. Okay, that's WHO guidelines for you. Now, what is the need of the self-care? Millions of people, including in India, face the twin problem. That is one, the acute shortage of healthcare in workers and lack of essential health services. That is the reason. I am not saying that you should not work on increasing more health workforce or you should not focus more on essential services. But till the time there is a crunch, something called self-care needs to be promoted, as we are talking right now. I am not saying, or the government is not saying that COVID may we have completely left you. Or it's just that till the time we have paucity of infrastructure or the workforce, at least take care of yourself. Okay. Where does India stand in this regard? India has some distance to go before making self-care interventions for sexual and reproductive health freely available to women. Yeah, हमारे एक तो education is a problem, awareness is a problem. So, and there are a lot of क्या कहते हैं, stigma तो नहीं कहूँगी, apprehensions. So it is not very easy that if you ask a women to consume this pill or this, they might not be very open to it. So abhi bhi there's a lot which needs to be done. Okay, home-based pregnancy testing is most commonly used self-help diagnostic in the area in India. Yes, that has now become a very I don't know whether I should say a common scenario, but yes, now majority of the women are at least aware of this home-based pregnancy kits. Then self-managed abortion using morning after pills taken soon after unprotected sex, like this misoprostol or mifepristone, taken a few weeks into pregnancy. So this is also, they have talked about that how self-care in the field of reproductive and sexual rights have been talked about. Then WHO has also approved HIV self-test to improve the access to HIV diagnosis. But despite this, in India, it is still under the process of validation. WHO ने approve कर दिया, but अभी India में नहीं हुआ है. ठीक है, people shy away from getting tested for HIV because of the stigma and discrimination. Is that very clear? So home-based testing provides you the much-needed privacy. Did you get my point? ठीक है. So what needs to be done? So one of the points that you can write is that the concept of self-care needs to be promoted. And for example, especially in the field of sexual and reproductive rights or health and rights. Is that clear? And then you can give the example. Next, fighting AIDS and TB, that's a very specific argument which I've given. For example, but जो लिख सकते हो वो देख लो. What you can write here is right-based, community-led, gender-sensitive, person-centered approach to reduce stigma and discrimination. This can be written. Okay. So you need to sensitize the healthcare providers. It should be right-based, person-centered approach. Their privacy needs to be respected because there's a lot of stigma and discrimination associated with this. Then you can adopt latest scientific research and medical knowledge. There has to be strong political leadership which is proactively fighting against the stigma and discrimination. Is that very clear? Okay. Now, you need to provide not only the treatment but also the legal literacy to the people, that in case they have been discriminated, their privacy has been compromised, then what are the legal route that they can be adopted? In case they have been denied the treatment, then what are the routes that they can take up? Is that very clear for everyone? I hope this is clear. Then next they say that you need to focus. These are the way forwards. The first way forward is concept of self-care. The second way forward is there are certain diseases which has stigma and discrimination associated. For example, tuberculosis or HIV/AIDS. In that scenario, what more can be done? For example, proactive participation by the community, by the political leadership, legal literacy, more awareness, people-centric approach, right-based approach is the need of the hour. Then the focus has to be on universal health coverage. Then obviously the expenditure needs to be increased. It's written here. The expenditure needs to be increased. Is that very clear? Okay. So in general, these are few points which can be written. There are certain other points which I've also made for you. For example, Cuba model of preventive healthcare can be implemented. यहाँ पे healthcare is free, compulsory, and it is preventive. So Cuba example can be copied. Then you can take inspiration from model of Thailand. There also the healthcare services is like a fundamental right which is being provided to the people. So the examples or the inspiration can be drawn from international model of healthcare system. For example, Cuba, Thailand. So that can be one of the argument which can be given. Similarly, raising taxes on harmful commodities. Obviously, you have beverages, you have sugar drinks, you have fatty foods, you have cigarette, tobacco, alcohol. So on all these harmful commodities, the taxes can be increased. It will help generating fiscal space for health, more money, more funds to be spent on healthcare. Then digital technology. आपने सुना होगा टेलीमेडिसिन का कॉन्सेप्ट, ठीक है. Then eco clinics are there, ठीक है. So you have extensive community healthcare outcomes. So eco clinics is, I'll give you an example. Suppose I am a specialized doctor. You are a doctor, a primary doctor in some rural area. Now a patient came to you. Now the patient is suffering from a disease and you're not very comfortable in diagnosing, making the diagnosis. Then you approach me. I am here, the specialized doctor. Through this internet, through this video, I am going to address the problem, and based on whatever directions I'm giving, you are going to treat the patient. This is how eco clinic works, where the specialized doctor is not directly interacting with the patient. The interaction is via the middle doctor, which is who is there in their area. But on the contrary, telemedicine is a concept where patient through this internet can directly interact with the doctor and can take the references. Is that very clear for everyone? Is it making sense? So digital technology can also be used. Artificial intelligence can be used basically to improve the availability and accessibility of the healthcare. Is that very clear? Then next we have public-private partnership needs to be increased. See, funding is a major issue, and we've already seen that in private sector, since there's a lot of competition, the services provided are far better than the government services. That we have already seen. Let's not debate about it. So if private sector intervenes, then as a result, you can get access to best possible healthcare infrastructure and services. And with the intervention of the government here, you can at least provide these services to not so economically well-off people at a subsidized rate. So there has to be a public-private partnership. The concept of CSR can be introduced here. Is that very clear? Next, there is a large proportion of allocated budget which is not utilized. I already told you health is a state subject. So many a times it is the implementation which becomes the challenge. And why? Because there is problem of governance. So in that situation, you need to ensure that all the bottlenecks in allocation, disbursement, timely flow of funds, it needs to be done away with. Is that very clear for everyone? Okay. Now, there are few more points which I wanted to give. So very quickly, pick up a paper and a pen and write down the points. First, way forwardly. You need to shift to the preventive healthcare. Yes, it's enough that we are focusing on curative care. Now we need to shift to preventive healthcare. Second, attitudinal change with respect to the conception of health. Attitudinal change with respect to the conception of health. So the first, see, सब कुछ मैंने दिया है, थोड़ा एक्स्ट्रा मुझे लग रहा था, इसलिए एक दो पॉइंट्स और लिख लो. First is shift to preventive health care. Second is attitudinal change with respect to conception of health. Third, women should be treated as an agency of health. Women should be treated as an agency of health. What I mean, I'll explain. For example, Amartya Sen observed that women empowerment, Amartya Sen observed that with women empowerment, fertility rate, maternal mortality rate, IMR can significantly reduce. Amartya Sen observed that with women empowerment, fertility rate, infant mortality rate, maternal mortality rate can significantly reduce. Hence, what he meant was that women should be treated as an agency of health. Next, we have already talked about, write down, use of self-help groups, PRIs, strengthening of ASHA, etc. Use of self-help groups, PRIs, strengthening of ASHA, etc. It will help in better delivery of services, health services at grassroots level. It will ensure better delivery of healthcare services at grassroots level. Clear? Next, rejuvenation of indigenous medicinal system. What I mean is Ayush. Rejuvenation of traditional medicinal system. Next, learning from successful healthcare models. Learning from successful healthcare models. For example, Mohalla clinics of Delhi. For example, Mohalla clinics of Delhi. E-healthcare of Odisha. E-healthcare of Odisha. Odisha has established 127 telemedicinal centers. I have already told you what is telemedicine. So yes, Odisha has established 127 telemedicinal centers. So that is Odisha e-healthcare model. Okay. Next, bridge courses. I have talked about it in the previous session. You can write down bridge courses. For example, to introduce courses for Ayush doctors for allopathy medicine. To introduce bridge courses for Ayush doctors for allopathy medicine. Introduce bridge courses for Ayush doctors for allopathy medicine. Next, last, ethics. To inculcate ethical value of service among the healthcare professionals. To inculcate ethical value of service among health professionals. Is that clear? See, this is again, I will repeat my favorite statement. This is not the sacrosanct list of the points. You can add more points. But as far as I'm concerned, I think this is a very comprehensive material on health which I've provided. I hope this is going to help you. You can make one statement here. Amartya Sen observed, he has drawn an analogy, you can write it down. India's healthcare system, write down, India's healthcare system represents islands of California, bracket में लिखना achievements, islands of California in the Sea of Sub-Saharan Africa. Sea of Sub-Saharan Africa. That is challenges. मतलब हमारे थोड़े थोड़े achievements हैं, बहुत बड़े pool of challenges में there are small achievements also that we have made in the healthcare sector. So the analogy goes like that it represents islands, small islands of California in the large sea of Sub-Saharan Africa, which are the challenges. So I hope with this the health as an overall issue comes to an end and you've understood what exactly I'm trying to convey. With this, the session comes to an end. Tomorrow I'm going to come up with another and the final session that would be on education. Till then, revise whatever I've discussed. Try attempting previous year essay and questions. If you find any difficulty, you know where to contact me. Take care. Stay safe, stay healthy.